Right now, state health officials are warning residents on what to look out for and how to protect yourself from the measles.
This after the state confirmed its first measles case this year. Here's the latest information tonight from the Pueblo Health Department. Officials say the measles patient is an unvaccinated adult who recently traveled to Mexico, where there's an ongoing outbreak of cases. The person returned to Pueblo, went to work, and eventually to a local urgent care. A lab reported the results to the state yesterday. Staff are now conducting contact tracing for people at the Southwest Deli and Cafe in Pueblo. That's between March 17th and the 21st. And people who are at the Southern Colorado Clinic from 3:30 to 6. That's on March 22nd. And right now, Fox 31's Kim Posey is live at the State Department of Public Health and Environment with more on the risks. Kim.
Yeah, today state health officials here told us that measles is the most transmissible infectious disease that they know of. And 9 out of 10 people who lack immunity and are exposed will become infected.
People may have measles, but may actually think they have something more like a cold or the flu or COVID.
Dr. Rachel Herlihy, the state epidemiologist, says measles symptoms typically start out with a cough, runny nose, red eyes, and a high fever. 3 to 5 days later is when the rash starts on the face and descends down the body. Patients can infect others 4 days before the rash and 4 days after the rash appears. The good news, she says, is that a 2-dose MMR vaccine is 97% effective at preventing infection, and it offers lifelong protection. In Colorado, the vaccination rate for school kids is 94%, but herd immunity requires 95%.
So statewide, we are falling short of that. So that does mean that Colorado is potentially at risk for outbreaks. But honestly, what is most concerning are pockets of undervaccination.
The first dose of the vaccine is usually given at age 1, so infants are at a greater risk. Plus, there are many older people who are not sure of their vaccination history. Some, the doctor says, may want to consider getting a dose now.
We know that there is a small group of individuals who were vaccinated with an earlier version of the vaccine that is not as effective. So that would have been people who were vaccinated before 1968. Those individuals are recommended to go ahead and receive a dose of the MMR vaccine if they have not.
Now, some older adults may have received just 1 dose of the vaccine, but the doctor says that is still 93% effective. But if you are traveling internationally to areas with measles outbreaks, she says you may want to consider getting another dose of the vaccine. It's also possible to request a blood test to check your immunity. Kim Posey, Fox 31.